Setting: Hospital accident and emergency department. Your patient is a 40-year-old man who has come to the emergency department with a dog bite on his hand. Now, let's see the task. First one says, find out the reason for patient's visit to the emergency department. Second one says, find out more details about the dog bite, like time frame and severity. Third one says, ask about the patient's care of the wound, cleaning and dressing, application of antiseptic cream and self-administered pain relief, etc. Fourth one says, explain the next steps: cleaning, assessing the wound, examination by the doctor, blood test to check the infection, possible X-ray to check for bone or tendon damage, then appropriate antibiotics and pain relief. Fifth one says, recommend a tetanus booster. Sixth one says, explain the current recommendation for animal bites. No stitches are required for wound initially. Easier to clean, less risk of infection. Then review it after a few days. Seventh one says, advise the patient that the doctor will confirm treatment of wound on examination. The last one says, find out if he has any more questions. Now let's get into the role play. You can start like, hi, good morning, my name is Denver and I will be your attending nurse in this emergency department. You look so worried. How may I help you today? Then interlocutor may respond to saying, nurse, I was bitten by a dog in my hand. Then respond to him saying, I'm really sorry to hear that. Try not to be worried at all. This can be well managed with certain treatment modalities. Before proceeding further, may I know your name and age for documentation, please? Then interlocutor may respond to saying, my name is Daniel and I'm 45-year-old. Then ask him, okay, Mr. Daniel, can you please let me know what exactly happened? Then interlocutor may respond to saying, I was just walking around my garden this morning. Then a stray dog attacked me. I understand that there are a number of injuries on my hand, so I'm really worried. Then respond to him saying, I'm really sorry to hear that, Mr. Daniel. I know it must be really painful, but don't be worried. Would you mind if I examine your wound, please? Then interlocutor may agree with that. Then respond to him saying, thank you, Mr. Daniel. Based on my examination, I understand that the dog bite has broken the skin several places and that the wound is bleeding heavily. In spite of this, the wounds are not too deep. But try not to be worried. This can be completely treatable. And we are here to help you. Okay, Mr. Daniel, before going further, may I ask you some more questions in order to understand your condition? Then interlocutor may agree with that. Then ask him, okay, Mr. Daniel, have you done any measures to manage your wound, such as cleaning and dressing? Then interlocutor may respond by saying, nurse, I was really scared after the incident. However, I just poured some water on the wound site, but I could not do anything else because I was not aware of anything. Then respond to him, okay, Mr. Daniel, did you apply any antiseptic cream? The interlocutor may tell you like, no, nurse, I did not do anything. Then respond to him, no worries, Mr. Daniel. I'm glad to hear that you have cleaned the wound site. Okay, did you take any pain medication to manage your pain? Then interlocutor may respond by saying, yes, nurse, I took a paracetamol to get some relief from the pain. But unfortunately, I did not get any kinds of relief from the pain. Then respond to him saying, please relax, Mr. Daniel. Don't worry. We can start the treatment immediately, so you'll be alright. Then interlocutor may ask you, okay, nurse, thank you. May I know how are you going to manage the wound? Then respond to him saying, I can sense your worries, Mr. Daniel. Do not panic. I will explain to you the treatment procedures in detail. Firstly, we will wash the wound site with saline water and slow the bleeding with a paper towel, and I will apply over-the-counter antibiotic cream. Then wrap the wound with a sterile bandage. Then keep the wound bandaged until you see the doctor. After the detailed examination by the doctor, he may ask you to do your blood test to check if there are any infections. Then he may prescribe you certain medication which includes antibiotics and pain relief medications. In addition to that, the doctor may ask you to take an X-ray to ensure that there are no bone or tendon damages. Are you following me, Mr. Daniel? Then interlocutor may agree with that. Then continue by saying, I'm glad to know that. In addition, it is also important to take the tetanus booster now. As you know that tetanus is a serious, potentially life-threatening infection that can be transmitted by an animal or human bite. So this tetanus booster prevents any infection caused by dog bite. Is it okay with you, Mr. Daniel? Then interlocutor may tell you like, sure, nurse. However, I understand that there are multiple injuries on my hand. Does it require any stitches? Then respond to him saying, I appreciate your thought, Mr. Daniel. According to the current recommendations for animal bites states that we do not really recommend any stitches for the wounds from animal bites initially, because of which the wound will be easier to clean and also there will be less chances of infection. I hope you're following me. Then interlocutor may respond to saying, it's good to hear that, nurse. Then respond to him, okay, Mr. Daniel, the doctor will examine your current situation in a few minutes and confirm the treatment modalities. Also, you need to come for a review after a few days. Is it okay with you? Then interlocutor may tell you like, sure, nurse, but can I meet the doctor now? Then respond to him saying, I acknowledge your concern, Mr. Daniel. Currently, doctors are dealing with critical patients. However, you don't have to worry. We will have the doctor here in a couple of minutes to examine your condition in detail and to advise you on the best possible treatment options. Is it okay with you, Mr. Daniel? Do you have any more questions? Then interlocutor may tell you like, no, nurse, thank you. Then respond to him saying, I appreciate your willingness to wait for the doctor, Mr. Daniel. Now, I would like to summarize what we have discussed until now. So far, we have discussed the management of injuries after the dog bite. I hope you understand that the doctor will be here within a couple of minutes and initiate the treatment procedures, so you can relax here until then. In between, if you have any more questions or concern, you can contact me. I'll be glad to assist you. Thank you, Mr. Daniel, for your valuable time. I wish you a speedy recovery. Thank you, guys. Role play ends here.